Silent signs of artery blockages you can't ignore. Artery blockages, also known as atherosclerosis, occur when fatty deposits plaques build up in the arteries, restricting blood flow. Over time, these blockages can lead to life-threatening conditions such as heart attacks or strokes. The dangerous part is that artery blockages often develop silently, without obvious symptoms, until a major problem occurs. Recognizing the subtle signs can help prevent severe complications. Here's a detailed look at the silent signs of artery blockages you shouldn't ignore. 1. Chest discomfort. Angina. A key warning sign of artery blockages. Discomfort, also known as angina, is one of the most common and critical warning signs of artery blockages. It occurs when the heart muscle doesn't get enough oxygen-rich blood, often due to narrowed or blocked coronary arteries. While many people associate chest pain with a heart attack, angina is different. It is a warning signal that your heart is under stress and not receiving enough blood. Understanding the nature, types, and warning signs of angina can help you seek timely medical attention and prevent life-threatening complications. What does chest discomfort angina feel like? Angina can manifest in different ways depending on the individual. Some people describe it as a feeling of pressure, tightness, or squeezing in the chest, a sensation of heaviness or fullness, as if something is sitting on the chest, a mild, burning or aching pain, sometimes mistaken for heartburn or indigestion. The discomfort may also radiate to other areas such as the neck, jaw, shoulders, back, or arms, especially the left arm. It often occurs during physical exertion, emotional stress, or after a heavy meal and typically goes away with rest or medication such as nitroglycerin. Types of angina. There are different types of angina, each with unique characteristics and implications. Stable angina, the most common type of angina, occurs predictably during physical activity or stress. The discomfort usually lasts a few minutes and goes away with rest or medication. It indicates that the heart is working harder than usual due to partial artery blockages. Unstable angina, a medical emergency, occurs suddenly and unpredictably, even at rest or with minimal exertion. The pain is more severe and lasts longer than stable angina. It may not improve with rest or medication. This type of angina is a warning sign of an impending heart attack and requires immediate medical attention. Variant Prinzmetal's angina, a rare form of angina caused by a spasm in the coronary arteries, can occur at rest, often during the night or early morning, usually relieved by medication such as calcium channel blockers or nitroglycerin. Microvascular angina involves the small blood vessels of the heart rather than the major arteries. Common in women, particularly after menopause. Symptoms are similar to stable angina but may last longer and be more difficult to diagnose. What causes chest discomfort? Angina. The primary cause of angina is reduced blood flow to the heart muscle due to coronary artery disease (CAD), the most common cause, where plaque buildup. Atherosclerosis narrows the coronary arteries. Blood clots, partial or complete blockages in the arteries. Coronary artery spasm, temporary tightening of the artery walls. Severe anemia or low blood pressure, reducing oxygen supply to the heart. Risk factors for angina: high cholesterol, high blood pressure, hypertension, smoking, diabetes, cholesterol of physical activity, family history of heart disease, stress. You shouldn't ignore chest discomfort. Ignoring chest discomfort or treating it as indigestion can be dangerous. Angina is a warning sign that your heart is not getting enough oxygen, which can lead to heart attack, myocardial infarction, complete blockage of an artery, heart failure, long-term damage to the heart muscle. Arrhythmia, irregular heart rhythms that can be life-threatening. What to do if you experience chest discomfort? Stop what you're doing, rest immediately. Take prescribed medication. If you have nitroglycerin, use it as directed. Call for emergency help. If the pain lasts more than 5 minutes or worsens, seek immediate medical attention. Preventing angina and artery blockages. Maintain a heart-healthy diet low in saturated fat and cholesterol. Exercise regularly, at least 150 minutes of moderate activity per week. Quit smoking and avoid secondhand smoke. Manage underlying conditions like high blood pressure, diabetes, and high cholesterol. Reduce stress through activities like yoga, meditation, or hobbies. Get regular checkups to monitor heart health. Final thoughts: chest discomfort from angina is the heart's way of signaling trouble. Recognizing this symptom and taking prompt action can save your life. Don't wait for severe pain or other symptoms. If you suspect something is wrong, seek medical advice. With the right lifestyle changes and medical care, angina can be managed, and future heart problems can be prevented. 2. Shortness of breath, a silent warning sign of artery blockage. Shortness of breath, also known as dyspnea, is a common but often overlooked symptom of artery blockages and heart disease. It can occur when your heart struggles to pump enough oxygen-rich blood to meet your body's needs, particularly during physical activity or even while at rest. Many people mistake shortness of breath for a sign of aging, lack of fitness, or lung issues, but it can be a critical early warning of serious heart problems, including coronary artery disease (CAD) and heart failure. Recognizing this symptom early could be life-saving. What does shortness of breath feel like? Shortness of breath from artery blockages may feel like a tightening sensation in the chest or difficulty taking deep breaths, feeling winded or out of breath after mild activity such as climbing stairs or walking short distances, an unsettling feeling of air hunger, where you can't seem to catch your breath, breathlessness that gets worse when you lie down, arrhythmia but improves when you sit up. This symptom can occur suddenly or gradually worsen over time. How artery blockages cause shortness of breath. Blocked arteries reduce blood flow to the heart, causing it to work harder to pump blood. Here's what happens inside your body. Reduced oxygen supply. Narrowed or clogged arteries restrict the flow of oxygen-rich blood to the heart and lungs. Increased heart strain. The heart has to pump harder, causing fluid to build up in the lungs, a condition called pulmonary congestion. Inefficient circulation. Without enough blood and oxygen, the lungs struggle to exchange oxygen efficiently, leading to breathlessness. Conditions associated with shortness of breath from artery blockages. Coronary artery disease (CAD), the most common cause of heart-related shortness of breath. Narrowed arteries reduce blood supply to the heart, especially during physical exertion. Heart failure, often a result of prolonged artery blockages, causes fluid to back up into the lungs. Pulmonary edema, making breathing difficult. Heart attack, a sudden blockage in a coronary artery. Shortness of breath can occur with or without chest pain, especially in women. Arrhythmias, irregular heartbeats, can cause the heart to pump inefficiently, reducing oxygen delivery and causing breathlessness. Warning signs that shortness of breath could be heart-related, occurs during mild activity or even at rest, accompanied by chest discomfort, dizziness, or nausea. Worsens when lying flat but improves when sitting up. Arrhythmia, sudden, severe breathlessness with a feeling of impending doom. Nighttime shortness of breath that wakes you up. Paroxysmal nocturnal dyspnea. Shortness of breath in women. Women are more likely to experience shortness of breath as a primary symptom of heart disease, often without the classic chest pain. This is why it is crucial for women to take breathlessness seriously, especially when it occurs during routine activities. Diagnosing shortness of breath related to artery blockages. If you experience unexplained shortness of breath, a doctor may recommend electrocardiogram (ECG) to check for heart rhythm issues. Stress test to observe how your heart responds to exertion. Echocardiogram to assess heart function and blood flow. Coronary angiography to visualize artery blockages. Chest X-ray to detect fluid in the lungs. Pulmonary edema. When to seek immediate medical help. Call emergency services if your shortness of breath is accompanied by chest pain or discomfort, pain in the arms, neck, jaw, or back, dizziness, fainting, or extreme fatigue, blue or gray lips or fingertips, signs of low oxygen. How to prevent shortness of breath from artery blockages. Eat a heart-healthy diet, rich in fruits, vegetables, whole grains, and lean proteins. Exercise regularly. Aim for at least 150 minutes of moderate exercise per week. Quit smoking. Smoking damages blood vessels and reduces lung function. Manage chronic conditions. Control blood pressure, cholesterol, and diabetes. Reduce stress. Practice relaxation techniques such as meditation or deep breathing. Maintain a healthy weight. Excess weight strains the heart and lungs. Final thoughts. Shortness of breath may seem like a minor inconvenience, but it can be a silent alarm signaling heart trouble. If you notice breathlessness during daily activities or at rest, especially if it is new or worsening, do not ignore it. Early diagnosis and lifestyle changes can prevent artery blockages from leading to heart attacks or heart failure. 3. Fatigue. A silent warning sign of artery blockage fatigue, or extreme and persistent tiredness, is often overlooked as a symptom of heart problems. Many people attribute fatigue to stress, aging, or lack of sleep, but when it becomes chronic and unexplained, it can be a critical warning sign of artery blockages and heart disease. Fatigue can signal that your heart is struggling to pump enough blood through narrowed or blocked arteries, reducing oxygen supply to your body's tissues. How artery blockages cause fatigue. Artery blockages reduce blood flow, forcing your heart to work harder to circulate oxygen and nutrients. As a result, oxygen supply decreases, your muscles and organs receive less oxygen, making you feel exhausted even with minimal activity. Heart overload. The heart works harder to pump through narrowed arteries, using more energy and causing overall fatigue. Poor circulation. Inadequate blood flow slows down your body's ability to clear out waste products from cells, contributing to tiredness. What does heart-related fatigue feel like? Heart-related fatigue can feel different from regular tiredness. People often describe it as unrelenting exhaustion that doesn't improve with rest or sleep. Feeling tired after simple activities like walking, climbing stairs, or doing household chores. Morning fatigue, even after a full night's sleep. Sudden, extreme weakness, or a feeling of being wiped out for no clear reason. Why fatigue can be a silent heart symptom. Like chest pain or shortness of breath, fatigue can creep in slowly and may not seem urgent. This is why many people, especially women, ignore it until more severe symptoms, like chest pain or a heart attack, occur. Heart conditions linked to fatigue from artery blockages. Coronary artery disease (CAD). Fatigue is a common early symptom as blocked arteries reduce blood flow to the heart muscle. Heart failure. Fatigue occurs when the heart can't pump enough blood to meet the body's needs, causing poor circulation and fluid buildup. Silent heart attack. In some cases, fatigue is one of the only warning signs of a heart attack, especially in women. Arrhythmias, irregular heartbeats. Fatigue can result from an inefficient heartbeat that reduces blood and oxygen supply to tissues. Fatigue in women. An overlooked heart symptom. Women are more likely to experience fatigue as an early warning sign of heart disease compared to men. Often, women do not have the classic chest pain but instead report symptoms such as persistent, unexplained fatigue, sleep disturbances, shortness of breath, anxiety, or a sense of unease. Warning signs that fatigue could be heart-related. Fatigue that gets worse during physical activity but improves with rest. Feeling exhausted after light tasks such as cooking or walking. Fatigue with chest discomfort, shortness of breath, or dizziness. Persistent fatigue despite adequate rest and nutrition. Nighttime fatigue that disrupts sleep. How doctors diagnose heart-related fatigue. If you experience unexplained fatigue, especially with other symptoms like shortness of breath or chest discomfort, your doctor may recommend blood tests. You check for anemia, thyroid issues, or heart damage markers. Electrocardiogram (ECG) to detect heart rhythm issues. Echocardiogram to assess heart function. Stress test to evaluate how your heart performs under exertion. Coronary angiography to check for artery blockages. Preventing heart-related fatigue and artery blockages. Eat a heart-healthy diet. Focus on fruits, vegetables, whole grains, and lean proteins. Exercise regularly. Aim for at least 150 minutes of moderate activity per week. Get enough sleep. Prioritize rest, aiming for 7 to 9 hours per night. Quit smoking. Smoking accelerates artery blockages. Manage stress. Practice relaxation techniques like meditation or deep breathing. Stay hydrated. Dehydration can worsen fatigue and stress the heart. Monitor heart health. Keep track of blood pressure, cholesterol, and blood sugar. 4. Pain in the neck, jaw, back, or shoulders. A silent warning sign of artery blockage. Pain in the neck, jaw, back, or shoulders can be an early and often overlooked sign of artery blockages and heart disease. While most people associate heart issues with chest pain, discomfort in these areas may signal that the heart isn't receiving enough oxygen due to narrowed or blocked arteries. Recognizing this warning sign is critical because it can appear without any chest pain, especially in women. How artery blockages cause pain in these areas. Blocked arteries reduce blood flow, depriving the heart of oxygen. When the heart is under stress, it sends pain signals through the nervous system. However, because the nerves in the chest, neck, jaw, back and shoulders are interconnected, the brain may misinterpret these signals, a phenomenon known as referred pain. Where and how the pain can occur: neck pain can feel like tightness, pressure, or a dull ache. It may worsen with exertion and subside with rest. Jaw pain, often mistaken for a dental issue. The pain can be on one or both sides of the jaw. Back pain usually occurs in the upper or between the shoulder blades. Shoulder pain may feel like an ache, heaviness, or pressure, typically on the left side but can occur on both. Pain in women, an overlooked heart symptom. Women are more likely to experience pain in the neck, jaw, back, or shoulders as their primary symptom of a heart problem, without classic chest pain. This can lead to delays in seeking help. Warning signs: the pain could be heart-related, occurs with physical activity and eases with rest, comes on suddenly or during emotional stress, is accompanied by shortness of breath, fatigue, nausea, or dizziness, feels like pressure or tightness rather than sharp, localized pain, occurs during the night or wakes you from sleep. Conditions linked to this type of pain: coronary artery disease (CAD). Narrowed arteries reduce blood flow to the heart, triggering pain signals. Heart attack, myocardial infarction. Pain in these areas, especially without chest pain, can be a sign of a heart attack. Angina, pain in the jaw, neck, or back during exertion, is a classic symptom of angina, which occurs when the heart isn't getting enough oxygen. Aortic dissection, medical emergency. Sudden, severe back pain could indicate a tear in the aorta, the body's main artery. Diagnosing heart-related pain. If you experience unexplained pain in your neck, jaw, back, or shoulders, your doctor may recommend electrocardiogram (ECG) to check heart rhythms. Echocardiogram to assess heart function. Coronary angiography to detect blockages in the arteries. Cardiac stress test to observe heart performance under exertion. Blood tests to check for markers of heart damage. 5. Erectile dysfunction (ED). A silent warning sign of artery blockages. Erectile dysfunction (ED). An inability to achieve or maintain an erection can be more than just a sexual health issue. It is often an early warning sign of artery blockages and heart disease, as the same processes that cause narrowing of arteries in the heart can affect blood flow to the penis. In fact, ED may appear 3 to 5 years before symptoms of coronary artery disease (CAD), making it a critical sign that should not be ignored. How artery blockages cause erectile dysfunction. Erections rely on healthy blood flow. When arteries are narrowed or blocked due to plaque buildup, atherosclerosis, blood flow to the penis is restricted, leading to difficulty achieving or maintaining an erection. The small arteries in the penis 1 to 2 millimeters in diameter are even narrower than those in the heart 3 to 4 millimeters in diameter, which is why it often appears before heart symptoms like chest pain, angina. Erectile dysfunction as a predictor of heart disease. ED often occurs 3 to 5 years before heart attack or stroke. Men with ED are at a 50% higher risk of heart attack, stroke, or cardiovascular death. ED is more common in men with diabetes, high blood pressure, and high cholesterol, all of which increase the risk of artery blockages. When ED could signal heart problems: sudden onset of ED with no apparent cause. ED accompanied by shortness of breath, chest discomfort, or fatigue during physical activity. ED with other cardiovascular risk factors such as high blood pressure, diabetes, or obesity. Morning erections stop completely, which can signal a physical rather than psychological cause. Conditions that link it to artery blockages: atherosclerosis, plaque buildup, the primary cause of both ED and heart disease. Plaque narrows arteries, reducing blood flow. Endothelial dysfunction, a condition where blood vessels cannot dilate properly. It is a precursor to both ED and heart disease. High blood pressure, hypertension, damages arteries over time, impairing blood flow to the heart and penis. Diabetes damages nerves and blood vessels, increasing the risk of both ED and cardiovascular disease. Metabolic syndrome, a combination of high blood sugar, excess body fat, and abnormal cholesterol levels, raising the risk of both ED and heart issues. Diagnosing heart-related erectile dysfunction. If you experience ED, your doctor may recommend a heart health evaluation, including blood tests to check cholesterol, blood sugar, and testosterone levels. Blood pressure check to detect hypertension. Electrocardiogram (ECG) to assess heart rhythm. Echocardiogram or stress test to evaluate heart function. Doppler ultrasound to assess blood flow in the penile arteries. Treatment options for AD caused by artery blockages. Lifestyle changes often improve both heart health and AD. Medications, such as phosphodiesterase inhibitors e.g. Viagra, Cialis, can help but won't address the underlying heart issue. Testosterone replacement therapy. For men with low testosterone levels, statins and blood pressure medications to manage cholesterol and hypertension. Angioplasty or stenting if severe artery blockages are found. 6. Lead pain or numbness. Peripheral artery disease PAD. A silent sign of artery blockages. Lead pain or numbness, especially during walking or exercise, can be a warning sign of peripheral artery disease PAD, a condition where narrowed arteries reduce blood flow to the legs. PAD is a strong indicator of artery blockages and increases the risk of heart attack and stroke, as it often results from the same underlying cause, atherosclerosis, plaque buildup in arteries. How artery blockages cause lead pain and numbness PAD. Peripheral artery disease occurs when arteries in the legs become narrowed or blocked by fatty deposits, plaque, reducing blood flow. This reduced circulation means that muscles in the legs don't get enough oxygen during activity, causing pain, cramping, or numbness, particularly during walking or climbing stairs. The pain usually stops with rest but returns when activity resumes, a symptom known as claudication. Common symptoms of PAD: lead pain or cramping, especially in the calves, thighs, or buttocks during activity. Numbness or weakness, often in the lower legs or feet. Coldness in one leg or foot compared to the other side. Sores or ulcers on legs or feet that don't heal quickly. Shiny skin, hair loss, or slow-growing toenails due to poor circulation. Weak or absent pulses in the legs or feet. Erectile dysfunction AD. In men, particularly if combined with lead pain. PAD symptoms in women. Women with PAD may experience atypical symptoms, such as fatigue or heaviness in the legs rather than pain. Burning or tingling sensations. Leg discomfort that is dismissed as arthritis or aging-related. PAD and its connection to heart disease. PAD is a red flag for systemic atherosclerosis, meaning if you have blocked arteries in your legs, you may also have blockages in your heart or brain arteries, increasing your risk of heart attack, coronary artery disease, ACAD, stroke, carotid artery disease, aortic aneurysm, life-threatening rupture of the aorta. When lead pain or numbness could be heart-related, pain during walking that stops at rest, intermittent claudication. Lead pain combined with shortness of breath or chest discomfort, numbness or coldness in the legs without an injury, sores on the legs that do not heal. Risk factors for PAD and artery blockages. Smoking, the #1 risk factor for PAD. Diabetes increases the risk of nerve and vessel damage. High blood pressure damages artery walls. High cholesterol promotes plaque buildup. Obesity increases strain on the heart and arteries. Aging, especially over age 50. Family history of heart disease or stroke. How doctors diagnose PAD. If you have lead pain, numbness, or other PAD symptoms, your doctor may recommend ankle brachial index (ABI), a simple, non-invasive test comparing blood pressure in your ankles and arms. Doppler ultrasound to visualize blood flow in the leg arteries. Angiography to identify blockages using contrast dye and imaging. Blood tests to check for diabetes, cholesterol, and inflammation markers. When to seek immediate medical attention. Sudden, severe lead pain or coldness may indicate an arterial blockage, acute limb ischemia. Lead pain combined with chest discomfort, possible sign of a heart attack. Open sores on legs or feet with signs of infection may lead to tissue death, gangrene. Preventing PAD and artery blockages. Quit smoking, the single most effective step to prevent PAD. Control blood sugar. If you have diabetes, lower blood pressure and cholesterol through diet, exercise, and medications. Exercise regularly. Walking is especially beneficial for PAD. Eat a heart-healthy diet, rich in fiber, low in saturated fats. Manage stress to reduce strain on your heart and arteries. Treatment options for PAD and artery blockages. Lifestyle changes. Regular walking programs improve circulation. Medications to lower cholesterol, blood pressure, and prevent blood clots. Angioplasty and stenting to open blocked arteries. Atherectomy to remove plaque from arteries. Bypass surgery to reroute blood around a blockage. 7. Cold or numb extremities, a silent warning sign of artery blockage. Cold or numb extremities, particularly in the hands, feet, fingers, or toes, can be a sign of poor circulation due to artery blockages. When arteries become narrowed or blocked by plaque atherosclerosis, it reduces blood flow to the extremities, depriving them of oxygen and nutrients. This symptom can be an early warning of serious cardiovascular conditions, such as peripheral artery disease (PAD), coronary artery disease (CAD), or carotid artery disease. How artery blockages cause cold or numb extremities. The arteries carry warm, oxygen-rich blood to every part of the body. However, when arteries become narrowed or blocked, the blood flow slows down, reducing warmth in the hands, feet, and fingers. Nerve endings suffer from low oxygen, causing numbness or tingling sensations. Tissue damage can occur in severe cases. Ulcers or gangrene can develop. Common symptoms of poor circulation from artery blockages: cold fingers or toes, even when the rest of the body is warm. Numbness or tingling, especially in the extremities. Discoloration. Fingers or toes may turn pale, blue, or purple. Pain or cramping often worsens during activity and eases with rest. Weak or absent pulse in the wrists or ankles. Slow healing sores on the toes, feet, or fingers. Symptoms in women. Women may experience colder extremities or persistent tingling without classic signs of chest pain or leg cramps. These subtle symptoms often lead to delayed diagnosis. Conditions that link cold or numb extremities to artery blockages: peripheral artery disease (PAD), narrowed arteries reduce blood flow to the legs and arms. Common cause of cold feet, leg pain, and non-healing wounds. Raynaud's phenomenon often occurs with PAD or autoimmune diseases. Fingers and toes turn white or blue in response to cold or stress. Coronary artery disease (CAD), blocked heart arteries can reduce circulation to the extremities. Numbness and coldness may occur with chest discomfort or fatigue. Carotid artery disease, blockages in neck arteries can reduce blood flow to the brain, causing numbness on one side of the body. Aortic disease, aneurysms or dissections of the aorta can restrict blood flow to the legs. When cold or numb extremities could signal heart problems: cold or numb feet while walking or exercising, relieved by rest, intermittent claudication. Numbness that spreads from the legs to the arms. Sudden coldness or numbness in one limb may signal an arterial blockage. Cold extremities with chest pain, dizziness, or shortness of breath. Skin color changes pale or bluish with pain. Treatment options for cold or numb extremities from artery blockages: lifestyle changes, such as walking therapy for PAD. Medications to improve circulation, reduce cholesterol, and prevent blood clots. Angioplasty and stenting to open blocked arteries. Bypass surgery to reroute blood around a blocked artery. Vasodilators, medications to widen blood vessels. Compression therapy to promote circulation in the legs. Dizziness or lightheadedness, a silent warning sign of artery blockage. Dizziness or lightheadedness, feeling faint and steady, or like the room is spinning, can be a sign of reduced blood flow to the brain. It is often linked to artery blockages, atherosclerosis, which limit oxygen-rich blood from reaching vital organs. This symptom can signal serious cardiovascular issues, such as carotid artery disease (CAD), coronary artery disease, or heart valve problems. How artery blockages cause dizziness or lightheadedness. Artery blockages can reduce or interrupt blood flow to the brain, causing brain oxygen deprivation, resulting in dizziness, confusion, or even fainting. Low blood pressure, due to poor heart function from narrowed arteries. Heart rhythm problems, arrhythmias, irregular heartbeats can cause lightheadedness. Impaired inner circulation, affecting balance and causing vertigo. Common types of dizziness from artery blockages: lightheadedness, feeling faint or like you might pass out. Vertigo, a spinning sensation, even when you are still. Unsteadiness, trouble keeping your balance, especially when walking. Presyncope, feeling like you are about to lose consciousness. When dizziness could signal heart problems: dizziness with chest discomfort or shortness of breath, possible heart attack. Sudden dizziness with numbness or slurred speech could indicate a stroke. Dizziness upon standing, orthostatic hypotension, may signal heart valve issues. Recurring dizziness during physical activity could indicate coronary artery disease (CAD). 9. Irregular heartbeat, arrhythmia, a silent warning sign of artery blockage. An irregular heartbeat, also known as arrhythmia, is a condition where the heart beats too fast, too slow, or in an irregular pattern. While occasional palpitations are often harmless, persistent or severe arrhythmias can signal serious underlying issues, such as artery blockages, atherosclerosis that restrict blood flow to the heart muscle. Artery blockages can cause the heart to work harder, disrupting its normal rhythm and increasing the risk of heart attacks, strokes, and sudden cardiac arrest. 10. Swelling in the feet or ankles, a silent warning sign of artery blockage. Swelling in the feet or ankles, also known as edema, is often dismissed as a minor discomfort or the result of prolonged standing. However, persistent swelling in these areas can be a red flag for underlying artery blockages or other cardiovascular issues. This swelling occurs when fluid builds up in the tissues, and in the context of artery blockages, it signals problems with circulation and blood flow, particularly to the lower limbs.